The idea that osteoarthritis, a condition long considered a progressive and irreversible consequence of aging and mechanical wear, might be slowed, halted, or even reversed is nothing short of revolutionary. At the heart of this possibility lies a surprising culprit: senescent cells. These so-called zombie cells have become a central focus of joint and cartilage research, offering a new understanding of how osteoarthritis develops and, even more importantly, how it might be treated at its root cause rather than merely managed. Traditionally, osteoarthritis has been framed as a simple matter of biomechanical deterioration. Years of stress, overuse, and microtrauma erode the cartilage lining the joints, eventually leading to stiffness, pain, and loss of function. However, mounting evidence now reveals that osteoarthritis is also a disease of chronic inflammation and cellular dysfunction, particularly involving the premature senescence of chondrocyte, the specialized cells responsible for maintaining cartilage. In aging joints, these chondrocyte often enter a senescent state, halting cell division and tissue repair while secreting a toxic mix of inflammatory cytokines, proteases, and reactive oxygen species. This senescence-associated secretory phenotype, SESP, profoundly disrupts the joint microenvironment. It promotes cartilage breakdown, triggers low-grade synovial inflammation, and impairs the ability of healthy cells to regenerate damaged tissue. Over time, this creates a vicious cycle. Joint damage encourages more senescence, which in turn accelerates tissue degradation and pain. Far from being inert bystanders, senescent cells are now understood as active drivers of osteoarthritis pathology, turning what should be a localized injury response into a self-perpetuating degenerative process. This new perspective has fueled a surge of interest in senolytic therapies, compounds designed to selectively destroy senescent cells. In preclinical studies, the results have been remarkably encouraging. In animal models of osteoarthritis, clearing senescent cells from affected joints not only reduced markers of inflammation but also preserved cartilage integrity and improved mobility. Some studies suggest that even in already damaged joints, senolytics can slow further deterioration and possibly allow for partial recovery of joint function. This is a profound shift from traditional therapies, which focus only on symptom relief through painkillers, corticosteroids, or joint replacement surgery. One of the most widely studied senolytics in this context is a combination of dasatinib and quercetin, which has shown the ability to reduce the senescent cell burden in joint tissues and mitigate disease progression in mice. Another promising compound, fisetin, a plant flavonoid found in strawberries and apples, has demonstrated senolytic activity with a favorable safety profile. These agents work by inducing apoptosis, programmed cell death, specifically in senescent cells, which normal cells are able to resist. As senescent cells are cleared, inflammatory markers drop and the local tissue environment becomes less hostile to repair. Human trials are now in the early stages, but the potential is generating serious optimism. A small pilot study in patients with idiopathic pulmonary fibrosis, a disease also driven by senescent cells, found that dasatinib and quercetin improved physical function and reduced markers of inflammation. While not directly related to joints, these results suggest that senolytics may be safe and systemically effective in humans. More targeted trials for osteoarthritis are underway, and their outcomes could redefine how we view joint aging and degeneration. Beyond pharmacology, the senescence link also deepens our understanding of why lifestyle factors influence joint health so profoundly. Chronic metabolic stress, poor diet, obesity, and systemic inflammation all promote cellular senescence. This might help explain why weight loss, exercise, and anti-inflammatory diets are so consistently protective in osteoarthritis. They reduce the burden of senescence-inducing stress on joint tissues. It also suggests that combining senolytics with these lifestyle interventions could yield synergistic benefits, accelerating recovery and delaying or preventing the need for joint replacement surgery. Of course, many questions remain. How often will senolytics need to be administered? Will clearance of senescent cells alone be enough to rebuild damaged cartilage, or will it need to be paired with regenerative therapies like stem cells or growth factors? What are the long-term effects of removing these cells, some of which may have beneficial roles in wound healing or tumor suppression? These are important issues that future research must address. Still, the fundamental insight that senescent cells actively drive joint degeneration opens a powerful new therapeutic pathway. In summary, senolytic therapies represent one of the most hopeful advances in the treatment of osteoarthritis in decades. Rather than masking the pain or replacing the damaged joint, these interventions may actually target the biological engine behind the disease. If successful in humans, they could offer not just relief, but restoration, slowing or reversing a condition once thought to be an inevitable part of aging. The coming years will reveal whether this cellular-level strategy can fulfill its promise, but the emerging data already suggests we are entering a new era in joint health and regenerative medicine.